What's up, everybody? Welcome to this week's episode of the B3 podcast. I'm your host, Brett. That's it. Our show partners, Elite Nutrition. Check them out at EliteNutritionOmaha.com. Use code B3 at checkout for 10% off. Go to the store in Omaha or Lincoln, yell B3 and get a free shaker. We also have Rosewood Block to make the best cutting boards and barbecue, fully customizable. Check them out at rosewoodblock.com. Use code B3 at checkout for 10% off there also. And D&D Beef, they're local to Omaha. They ship nationwide. Use code B3 at checkout for 10% off there also.
We got to use those for holiday presents.
Yes, we do.
Yeah, the 10% off is nice. And she'll meet you like in a parking lot in Elkhorn, like a drug dealer.
I like that.
Just hand beef out to you.
Yeah, I like that.
We also have Omaha Barbell, the real Midwest Mecca, where we almost always record from. Stop by for a great time. And we have our friends from Core Physical Therapy here today, Mark and Claire.
Hello.
How are you guys?
Hi.
It's been a while.
I know.
It's been a while.
It
Yeah.
is.
Yeah, they were early.
Yeah.
Early to the show here.
What, like
Yeah.
25, 30, 40?
Yeah.
I don't know. It was a couple years ago, probably.
Yeah, it's been a little bit.
Mm-hmm.
But I thought after Tanner and I were silly and I tore my pec, it'd be a great time to talk about
Making
Tendon.
wise choices.
tendon, ligament, prehab, rehab, things that you can do to prevent it and things you can do to heal it and just keep longevity with it. And obviously you guys have seen, I've seen my fair share, more than I ever thought I would see, but you guys have obviously seen more.
We see it a lot.
Yeah. Yeah.
What do you think is the most common one you see? I'm assuming knees. Let's say from weightlifting. Let's say just from weightlifting, not sports.
Oh, gosh.
Bicep tear for sure.
Yeah. I mean, you do have to give the caveat that like what we see prevalent in men is not what we see prevalent in females. Like
See that?
I in my entire career, I've never seen a female
Bicep.
quad tendon tear or a patellar tendon tear.
I've
What
actually
about
never
female?
seen a bicep tear.
I was going to say, I figured you were going to say knees for weightlifting versus biceps.
I feel like biceps people ignore it for a while. They're like, it kind of hurts, but like I'll push through and then.
And it's
It
not
goes.
always in the weight room where you do it. You
Yeah.
irritate it there, but then it's somewhere else where,
I mean, statistically,
It happens.
hands down, no matter what, across the board, it's one of your rotator cuff tendons.
Yeah.
Because that's typically where we tear, is at the musculotendon junction.
bench pressing.
And now,
overhead pressing.
usually if it's a tear from the upper and the shoulder, you don't always have to surgically repair that one, right? But if it's on the bottom side,
Yeah, it
the
depends.
insertion, you normally have to fix that
It
one.
depends on what type of tear it is. You can have a longitudinal tear, which means it's going with the fibers of the tendon or with the fibers of the muscle. Those aren't necessarily always operative, or you can have a partial tear that isn't necessarily always worth it to have it surgically repaired. But obviously there's
Get a full thickness tear, you're probably going to
Yeah.
want to have that repaired.
just from a functional standpoint.
But it also depends where it is, because if you get a full thickness tear on the backside of the shoulder blade, likely you're not going to be able to repair that. You'd have to cut through the lat. You'd have to stitch hamburger to hamburger. So if the tear is off the front side of the shoulder, you can repair a full thickness. But if it's on the back, most people wouldn't even. I've never seen one done.
Now, let's say somebody in this room were to have torn like the upper part of their bicep, not the lower part, and it starts off real small, like the
get outta
size
here.
of like a quarter, just a teeny tiny little bit of bruising. That's not necessarily, you don't always have to surgically repair that, but so there's a lot of things that go into like the specific tendon about how it's torn and if you're going to repair it or not, if there's other things going on.
Yeah, and if you think of it like a piece of paper, not all tears are tearing the paper in half and separating the two. Some tears are just a tear in the paper itself, in the middle. That will heal, that will repair. But if the whole entire paper is torn in half, different problem. And it also depends on where in that system it's torn.
Now, what's the worst tear you've seen?
Oh.
I saw Brandon blow his patella tendon off in here, or whatever that was. Was that his quad tendon? Quad tendon?
I mean, they're essentially the same.
That one just sounded like a stick breaking.
Yeah. I mean, a traumatic or acute patellar tendon or quad tendon tear. So patellar tendon is just below the kneecap, and then quad tendon is above
Well,
the kneecap.
technically, it's not a tendon.
Well, yes.
It's,
If we want to get into
it's a patellar
semantics,
ligament. But anyway,
those are dramatic because there's obviously it's a very, very strong muscle or
lot
muscle
of
group,
tension.
and there's a lot of tension, and usually when it goes, it's like so. The first one that comes to mind is at what was it, the Omaha South powerlifting meet with Jason.
yeah.
Just because it was. I don't know. Sometimes you can see those things coming too.
Yeah.
You're like,
But with Brandon, it wasn't even heavy weight for him either.
No, but I had a weird premonition. Like when he was squatting that day, I was like, I feel like something's going to happen. And I love Brandon. You know what I mean? Like, I don't wish that on even my worst enemy.
No.
But I was just like, man, something. And then all of a sudden just like, and I was like, well, that sucks.
Well, and so in contrast, then when you hear about like Achilles tendon tears, which as a side note, and this will be like a quick little tangent, but I, in my 18 years of practice, had never seen an Achilles tendon tear in a female until like
more recently,
4 or 5 years ago.
Now, is that the estrogen?
They don't know why.
That?
They don't know why.
Well, the estrogen would prevent it in a way that, tissue elasticity for women is different. We know that, right? Which is
because
probably,
estrogen helps with that.
It's not necessarily always in the same age group. Like I've seen young gals tear their Achilles now, whereas before that would have been unheard of because of the hormonal profile. There's obviously other considerations in there, like supplementation and things like that. But up until maybe like the last 4 or 5 years, I had never seen a female Achilles tear, and now you see them definitely more frequently. Yeah. So that's an interesting.
Is that more in athletes or lifters? Not saying lifters aren't athletes, but
yes and no. I mean, you do. Like my young one was a competitive cheerleader, like a tumbler, and it was something that she had done like a million times, had zero history of Achilles
high
pain.
level. I mean, went on to go to division
collegiate,
so a high level, not somebody who was recreational by any means.
Yeah.
And I don't think she was supplementing.
No, but women probably 50 to 1.
Yeah.
Much.
Yeah. But in contrast to like a patella or a quad tendon, then you hear above and beyond, like when people tear their Achilles, is that they're like, I had no idea what happened. It was fairly painless. It just kind of felt like somebody kicked me. And they don't have that immediate pain response that you see with like a biceps tear or a rotator cuff tear or a quad tendon, a patella tendon, anything like that. Achilles tendons are
not even usually painful. Most people don't even complain of pain. They just
they're just like, oh, it was weird. Like I couldn't move my foot.
And somebody just went up and hit him in the back of the leg.
Mm-hmm.
So I was starting with that one because you don't hear like a lot of how it just happens. What's the best prehab for that to prevent? I mean, is it as simple as just like calf raises?
Probably eccentric loading.
Eccentric loading. I think the number one reason is tightness, right? We always wear these shoes that have high heels on them. We walk around, not like those types, but
Carter bar shoes.
Yeah. If you're walking around with an 8 or 10 millimeter drop on your shoe all the time, and then you're squatting into a position and you're sprinting, it involves a lot of dorsiflexion. If you don't have that, there's a ton of tension at that end range. And so if there's no give in the system, it's going to go somewhere. And that's usually where it goes. Again, prevalent in men over 35, although we see it in athletes. Mm-hmm. There's an ethnicity component to it as well. We see it different ethnicities have more of those than others. Mm-hmm. But age groups for sure, 35 and over, men primarily.
So eccentric loading, which would be like the stretching part of it. Yeah. Obviously, like so, like on a calf raise, like a calf raise when you're lowering.
Slow
lower. It's like for anybody other when you're doing calf raises, the actual lowering and the stretch is a huge part of the exercise.
Yeah,
I think a lot of people look past that.
Yeah.
Yeah, I think a lot of people just go through.
So yeah, full range of motion. So let it stretch down, give it a little bit of time, and then your raise, obviously.
Mm-hmm. I also think, and I'm guilty of this as well, but like really kind of focusing on those warm-up sets of form, right? Like so many times you see people squatting and they're like, they get down to the bottom and they like kind of shift forward and they come up on their toes and their heels lift. Well, that means that at that point, maybe it warms up and it's not prevalent later on in your sets, but I mean, that's a signal that there's something tight in the system that is not allowing that normal motion to happen, and you're making a compensation for it. If you ignore that and it gets worse and worse and worse, then all of a sudden you're putting heavy load through something that's tight, and there is going to be a breakdown in the system somewhere.
Yeah, and that eccentric loading is important to build collagen and different types of strength in the tissue because it changes your tissue. So if you are going through the motions slower, you build more contractile strength because an eccentric muscle contraction can produce more force than a concentric one.
Yeah, I always tell people you get just as strong in lowering as you do raising.
You do.
Absolutely. And I think appropriate loading is something that we've just like completely have gone by the wayside. It used to be, and this is super old school, and I realize that with this resurgence of CrossFit and those sorts of fun workouts where there's a ton of plyos and things like that, it used to be for females, you had to squat like 1.5 times your body weight in order to be like safely cleared to do plyos, and men's were double. I don't know a whole lot of females who are out there being like, oh, let me squat, my body weight times 1.5 before I even think about doing a box jump. And so you have this huge increase of people who are doing just like inappropriate loading without taking into consideration what the long-term effect of that is.
Yeah, you do a box jump, you're looking at 3 to 4 times body weight load on the absorption of the impact on the bottom. And if you can't squat double, triple your body weight, or at least in some capacity produce that force, that's a huge difference in the amount of force that's going through your body. So it's just, and especially it's the speed of change, the rapid change in direction is the huge part. We see that a lot in Achilles tendons. It's not a slow exercise that happens. It's almost sprinting. It's the push off. It's the, I went into a burpee to a sprint, or a sled push sprint, or something where I was backpedaling and then I went forward. It's usually a quick change of direction as well.
Yeah.
Which people don't always train for.
Well, and you talk about the tightness. There was a kid here one time, and he already wore lifters, and he was like, "Hey, my heel keeps coming up. What do you think I should do?" And I was like, "Well, I think there's a lack of mobility in your ankles." I was like, "I would take your lifters off and squat in something flat-soled and work on your mobility. I'll just get a higher heel." And I was like, "Oh, okay, that'll fix it."
Yeah, and that's something very common that now with the internet, a click of a button, and all of a sudden you can solve a problem, and then it's still a problem, and you run out of ways to solve it until your body figures it out.
Well, and that's what I was talking to Mark before, the idea of doing this, because I think we've done something like this in the past when you guys were on here. But, I was a kid who was in here and he was asking me about my pec, and we started talking about different stuff for health, and I was like, well, and you were talking about supplemented athletes, and by supplement, we just mean roids. It's nothing crazy. But like Westside, they would always do like tricep extensions and things like that with a band, and they do like 100 reps of it. And that was more or less just for the blood flow. But none of these guys will read. Nobody will read anything old. If it's not on Instagram or TikTok tomorrow.
If it's not new and trendy, I'm not doing it, right?
But doing those I had a kid that came in here. He was last summer, and he worked for construction. He was in town, and he was talking about his elbow hurting. And I go, "Are you drug free?" And he like looks all like weird. I go, "I don't care either way." And he was like, "No." And I go, "Okay, well, you need to start doing like hundreds of reps of these."
Yeah.
And like 2 weeks later, he's like, "Oh, dude, it feels way better."
Yeah. And there's a reason, and not, whether people decide to supplement on their own, that's neither here nor there. We don't care from a medical standpoint of it. We just need to know one way or the other. Like, we don't want drastic changes in the middle of an injury rehab or an injury prevention protocol. Like, we don't need anything drastic where they were taking something and now they're not, or they weren't and now they are. So I don't really care about that. But there's a reason when there's a level of maybe the education isn't quite there with what you're doing that leads to an increased incidence of something like a tendon injury. And there's a reason behind it, is that you're increasing the strength of a muscle without the natural timeline that would allow the increase of strength of these tendons and ligaments. And that's where these faults happen.
And it's simply, there's just not as much blood flow in the tendons and ligaments as the
that's
muscle. You know what I mean?
Yep.
They just don't get the blood flow to stay healthy and grow. So especially if you get on a bunch of shit, well, and your muscles start growing way faster than your tendons and ligaments are ready for.
Yeah.
Yep.
Yeah. Okay. So we're going to talk about 3 different types of tissue, right? Ligaments, right? Tendons, and then muscles. So ligaments have super low blood flow, very little elasticity.
What does a ligament attach?
Bone to bone.
Thank you.
That's why there's no patellar tendon. It's a patellar ligament. But anyway, it doesn't flex much. It's designed not to flex, and because of that, if it tears, it rarely will heal. Generally.
Think of a seatbelt in your car, right? Like it's meant to stabilize. I use that example all the time when we talk about ACLs. It is meant to stabilize a joint. It's not meant for you to have a ton of mobility through, because there's just not great blood supply. It's meant to be stable, not mobile.
Yeah. So then you get into a tendon, right? A tendon is kind of that midway where it does have elasticity, especially if you're younger. As you get older, the elasticity will change, and I will probably talk a lot about the aging process in this too, because that's very important.
Wah, wah.
There's a lot of blood flow, but there's a lot of elasticity there. And then you get into the muscle, which is primarily blood and water with a contractile tissue with even more ability to stretch. The elastin, the collagen, it all moves. The sarcomeres move quite a bit more than the other structures. And so blood flow for muscle and tendon is huge, because that's how they take old tissue and repair it. And that's why the high rep, high volume stuff works so well, because you're flushing it. If you're doing a set of 5, how much blood flow are you getting in 10 seconds?
Well, and that's how you're not going to get the pump. That's why when you do like a set of, 20 bicep curls, you're like, man, I got like a major pump. But
Yeah.
when you do like a set of 5 squats, you're like, I don't even feel like I lifted.
No,
Right.
it's more of a structural strain than it is a muscle
Yeah.
metabolic strain. So they're both important.
And this is totally a different topic, but that's where a lot of the blood flow restriction research came out from, is that like capturing the benefits of blood flow being like shuttled into an area and all of the good things that come with that in terms of oxygen and growth factors and all the little precursors that your body has like running around in the blood to repair tissues, then that's where a lot of the research came from, is from tendon injuries and ligament injuries, and how do we increase blood flow to these areas.
Well, the interesting thing is we call it blood flow restriction, but it technically is not. It's actually venous flow restriction because the blood is coming from the arteries. Those are
We're
much
just not letting it
deeper. So we're
leave.
not letting it go back. So blood flow restriction is kind of a misnomer. It's not really that. It's venous return restriction. And that's why it pools, and the pooling shuttles more blood, and that's why you get such a great healing effect and a heck of a pump at a 30% load.
So I was gonna say, so do you think a blood flow restriction is equal to like a set of 30 with no blood flow restriction?
It'd be different because you're looking at metabolic stress versus structural stress. So
Right.
if you're doing a set of 30 and that's to failure, you're still getting some structural damage to the muscle. If you do a set of 30 with blood flow restriction, you're at 30% max, which is not going to change any structural, but you're going to get damage to that muscle tissue through a metabolic acidosis, basically. You're going to get a lactic acid buildup that's so acidic, you're going to get muscle damage via metabolic activity, not structural damage, which means you're not going to get sore from it, and you're going to heal faster from it, too. It's a completely different way to build muscle. It's a high-volume way to build muscle. Very low load, though.
Yeah.
So it's not better, it's just different.
Right. Not functional from a long-term standpoint.
No, it's a good accessory.
Right.
for
Like
prevention, but
an
it's-
injury.
But you're not going to get strong doing it.
Yeah.
You'll get stronger, but not strong.
Yeah. And I think that's what people miss out on back on the blood flow, just in general,
Yeah.
Yeah.
is to do the
And
extra stuff.
I get it. Like that stuff's not fun. It's not cool. It's not sexy, right? To sit there and be like, all right, I have my squat workout and I'm going to spend the first 15 minutes of it doing body weight stuff and, doing a hold down at the bottom and doing lighter weights and doing slow eccentrics. Like that's not cool.
It's not fun.
In comparison of like, yeah, let's load them up.
Well, and where are you guys going? Like, I remember when we first started competing, like you go to a meet and like everybody would just like, if any, like a foam roller was like, no one had one of those
Right.
with them, a band maybe. And you would just do dynamic warm up. You'd go squat like how you were talking. You would do a bunch of sets to kind of get going. Well, the smart ones would just do a bunch of sets. And now it's like they got a bag full of mobility stuff and it's like a 40-minute warm up.
That's probably overkill. So if you take something good and do a bunch of it, it becomes bad. It's too much, right? So you got to have it in the middle. And as you age, you need more mobility work because guess what? Your tissue changes as you get older. Your tissue is not the same every time you get 5 or 10 years older. The amount of elastin and collagen and fibroblastic activity changes. And so your genetic potential as you get older does change.
And not everybody's the same. I mean,
Correct.
I might need to spend a little bit more time on getting my hips to warm up and not necessarily have a problem with like how tight my calves are versus somebody else who, wears a wedge lifter where they might have to work a little bit more on like calf mobility to be able to have that motion or that range of motion in the squat. Like it's completely independent. And then this is a rant that I always make, so I'll keep it short, but just, people taking advice from the internet, ironically, we're on the internet, but you get these influencers who maybe they're under the umbrella of being like, I'm a healthcare professional or like, look at me, I'm a PT, but I will tell everybody who asks like, okay, I can give general advice, but that might not apply to you. Because until I see that actual person and say, like, that's what your problem is, because I've watched you run, I've watched you walk, I've watched you squat, I've watched you lunge. It doesn't matter. Oh, gosh. It doesn't matter what somebody on the internet who has like 2.3 million views says if it doesn't apply to you. But nobody cares about if it applies to them or not. They're like, I saw this on the internet, and so therefore I'm going to squat on a slant board and get my knees like 4 inches over my toes.
Well, and the internet has a lot of good information, a lot of bad information. And YouTube is like the worst for our profession because you'll have people watch these channels, right? And some of these people make a living at these channels that are prehab or whatever. That's fine. They make a living on making content. They don't make a living on fixing people, which is fine. But if you're taking advice from somebody who makes a living on making content and not fixing people, remember that. Take that with a grain of salt. They're making content that's interesting and cool and you want to watch it. It doesn't mean it's good or good for you or specific to you. If you fix people for a living, you know how to do it. If you make cool content, completely different skill set.
Yeah.
Well, and it's the same as lifters.
Absolutely.
You know what I mean? They'll like, well, I'm going to do what this guy does. Well, he's like the upper 1%. Like we had our first podcast ever was the common denominator. You know what I mean? Like what is the common, what are 99% of the people doing? Like I can go shoot baskets every day and I'm not going to be Michael Jordan. You just have to realize that. Like you're not going to be that athlete. I'm not saying you shouldn't strive for it, but the odds of you being the 1% in athletics is very slim. And you will know by the time you're 15 if you're in the upper echelon of sports. So I think that's the other problem as well. But people don't look at it at strength sports the same way they would at like basketball. Like, well, I'll never be like Michael Jordan, but they're like, oh, I can be like, you know, X lifter, whoever you want to put in there, whoever's strong at the time.
Yeah.
Well, and I also think that there's this attitude, for better or for worse, out there is kind of going off that same idea on the internet, is that like, oh, never miss a Monday, or like push through, pain is weakness leaving your body, all of these things. And there's absolutely times that I've trained through pain. I've trained through something where I'm like, all right, you know, like quit being a little bitch. Like you can do this, just warm up. You can push through this. It'll feel better afterwards. But there's also that element of like, there are things that you should not push through. And I think that's where a lot of some of the injuries that we see is that people are like, yeah, you know, especially at bicep, shoulder pain, sometimes patellar tendon, is that they're like, yeah, it's really been bothering me. And I knew that I needed to get in here and have you guys look at it. But like, I just kept training, or I just kept doing X, Y, and Z. And not to say that everybody has to come see us. I mean, there's
You should though. If you're messed up, you should.
You should. Yeah. But like, it's so much easier to take a small problem and fix it than it is to just keep pushing a bad position or pushing a bad hand. And then all of a sudden you're like, man, I went to reach into my back seat and tore my bicep just lifting up like my gym bag or my backpack from the back seat. Something I've done a million times, but you know, I had a hard workout. My shoulder was bothering me. My arm was bothering me. My elbow was bothering me.
And that's kind of that. Are you hurt or are you injured?
Right.
Yeah. Totally different.
There's a difference. And to what you were saying, like waiting forever, like I've been coming to see Mark for, I don't know how many years now.
A while.
But that was prior to that. That was like 10 years or 12 years of like aggressive, like conjugate training, doing nothing and being like, oh, that's fine. Well, then it just stacks and stacks and gets worse and worse. And then you're like, so now I just try to stay. Well, I'm still fixing shit from then on top of my pec, but it's just that shit just stacks up and it takes longer. Like how long we worked on my arm, like the elbow's been messed up forever. And it got to the point where like, if I felt like it locked out, it was going to just drop out and I wasn't going to have any support. So then I was like, I should probably get that worked on. But yeah, I mean, it's stay ahead of it.
Yeah. It's kind of like your suspension in your car. If something's going wrong with your suspension in your car and you ignore it long enough, you're going to have other problems that come about from that. If you get it fixed right away, you'll have a longer lifespan with that vehicle, right? So if you ignore things, they become bigger problems and more expensive problems, either with time or money or with your health. And the one thing you cannot buy back is your health.
Or time.
That'd be nice if it's good.
Or age.
Yeah, it's like on the suspension thing. You know, at first, you know, you got great suspension, then it goes bad.
Yeah.
Well, then it makes all the change rattle in your center console. And then like, you know what I mean? Like, that's the little shit you start you start to notice.
Change in your center console.
Who has change? No more pennies.
No.
Well, there's like 100 gazillion floating around still that will never run out, I don't think.
I have change. Mark hates it.
I have change in dollars.
She has a change purse.
I don't.
And because she's
don't
old
anymore.
at heart, she pays for cash and then gives them the change to make it an even amount. And young people being bad at math now, they don't understand what she's doing. It's 8.12. I'll give you 10.12.
10.12.
And
Yeah,
they're
like $2
what's
back. I don't
the
want
12 cents for?
$1.82
Ma'am,
back.
you paid too much.
I know. That's why I usually have
Yes.
to tell them. I don't have a change purse. I
Okay,
stopped that. It made my bag heavy.
You used to.
I just have I have like the little tray inside my center console that has change.
Like the little coin purse with the little things that go like this and you like open them up.
Yeah, it's the same thing. You used to have cigarettes in them too. That same snap style.
Or like a Werther's Original.
With no wrapper, obviously. I sucked on this yesterday, but it was only for a little bit. So what's your biggest thing for prehab? You think it's no matter what it is, just your warm up time, like
Well, I
the
think
blood
number
flow
one
stuff?
is proper programming, right? So
Yeah.
programming is the most important. If you properly program, it's got to be one of the best ways. Mobility is important too, but if you're improperly programming, mobility isn't going to help you prevent. Programming is number one, right?
You can't go 100% of the time.
No.
You have to understand the idea of doing cycles and doing different loading and rotating exercises.
Progressive resistance.
Exactly.
But then deloads are important. You can grow on a deload too. You get stronger on deloads.
Absolutely.
Yeah, super compensation, delayed
Yeah,
transformation, whatever you want to call it.
absolutely.
Yeah. Because that's even a lot of nervous system.
Correct.
Absolutely, yeah. And form and mobility, I think those two go hand in hand. A lot of times when we see a breakdown of form, yes, there can be a strength imbalance, but a lot of it is a mobility imbalance, that there's some sort of compensation pattern that's happening.
So then after those two things, right? Accessory work. So accessory work to me is like
Accessories.
I said.
Thank you.
Yeah, that's cheesy.
I
Accessories.
use it all the time. Thank you.
Cheesy, you guys. Okay, accessory. Those are doing things like that is increasing your traction on your car. So you have a car, you put more power on it, right? Well, you can't use it until you know how to use it and get the traction, right? So it's worthless until you can properly use it. So accessories are a way to stabilize your new strength and to use it properly without damaging something. And so accessories are not fun, just like you said, just like mobility is not fun, but it's more important as you get stronger from your baseline, and then your super physiological baseline is even more important if you're past that for some reason. Accessories are your limiting factor on injury prevention, other than programming and, mobility training.
And don't only do, and we've said it before in the accessories, don't only do what you like.
Oh, yeah.
You have to do what you're bad at.
Yep.
Yeah, do what you hate.
Yeah.
Yeah.
Probably means you're not good
And
at
there's
it.
nothing wrong with finishing your accessory day with a couple sets of high rep stuff. Like if it's on a leg day, maybe do some real light extensions or curls. You know what
Yeah.
I mean? For a bunch of reps, you do some extensions, tricep extensions or bicep curls, just for high rep.
Yeah, just do
To
a
get
set
that
of,
blood flow in
30
there.
lunges.
Yeah.
So,
Terrible, but-
slowing the motions down. I mean, you can sit there and, like you said, leg day and go heavy, and then sit there and be like, okay, I'm going to do some slow, very specific body weight lunges and still get benefit out of it.
Bulgarians would be a mobility drill for a lot of people too.
Yeah. And said, like, I'm not a pro one for like static stretching until after the workout. I assume you guys are in that same spot.
I agree, yeah.
Because your body depends on that elasticity that it's with your whole Golgi tendon, all that stuff depends.
GTOs, yeah.
I would actually say never static stretch before you do anything
No,
ballistic
always-
at all.
Yeah, I would
Ever?
say at the end of that workout or even the next day, outside of that workout, I think. Because, I back in the day at 24 Hour, I had, we were going to bench and I had this trainer that worked with us and she did this like chest stretching thing with us and my bench workout was terrible.
Of course. It decreases your
That
force
your-
production.
Yeah, your body adapts to that elasticity
And
you've
there's
developed.
certain stretches, I think, that they just lend themselves to almost, for lack of a better term, like wringing the blood out of a specific muscle. And if you're turning around and you're saying, okay, that's my warm up, and then you try to utilize that muscle, your muscle's like, nah, bro.
Yeah.
But I also think some of these like 20, 30-minute warm-ups, like Matt Wenning used to that whole Wenning and all those reps, like I think I look at like calories like a glass of water and you only got so much in there for the day. And if you want to waste them all on your warm-ups,
Well, you see a lot with people who are squatting, right? They're like, "Ooh, I'm going to do some hip openers. I'm going to do some banded walks." Great warm up. But if you're fatiguing yourself and your accessories before you work out,
yes.
so if you're doing band pulls before bench, great. But it should be super light. It should be blood flow only. If there's any fatigue and muscle burn, you're fatiguing your accessories before you're actually doing the heavy work. That's not the idea of a warm up. That is a pre-exhaustion. That's like a bodybuilder thing, but that's not what you do when you're lifting heavy.
Yeah. Yeah, save that shit for later.
Yeah. And do your accessories heavier. It's fine. There's time
Afterward, after.
but do it afterwards. Or, yeah.
But yeah, if you think you've torn something, which you'll know, get it checked out sooner than later.
Yeah, there. You touched on it earlier about, well, not every injury is surgical, and I think you meant that in a good way. Like, oh my gosh, not every injury is.
Especially if you have poor insurance. Like a lot of hardworking people have
people,
terrible insurance. So
Yes.
that's
And
when I
not-
tore my pec, that was the first thing I said to Mark. Do I need surgery because I have shitty insurance?
Well, yours was not a full detachment, thankfully.
No, yeah.
And not every injury is this horrific, like game-ending, life-threatening sort of injury. But there are those that become non-surgical because it was ignored for too long.
You mean surgical? They become surgical.
No, they become non-surgical because you can't fix it anymore.
Oh, you waited too long.
Yeah.
Well, non-surgicals become surgical, and then they become non-surgical again.
Correct. Yeah.
Okay.
Well, and if you go for surgery, it's way more awful, right? Because they almost have to detach where it started to scar down and then stretch it back out.
It depends how
Yeah.
long you wait. Yeah.
Yeah.
Like I can think of 2 or 3 patients that had kind of ignored some shoulder pain and they're like, I think I probably tore something, but it's fine. And then they go in, they get an MRI and they're like, yeah, that was a partial tear that we probably could have fixed and you would have had full function. But now you've waited so long, it's scarred down, that tissue or that tendon tissue isn't good quality anymore. And now you're not a surgical candidate. Like that does happen.
Now, what's your advice to people? You can give all the tips out right here. Someone, like we talk about shitty insurance. Let's say I feel like I tore something. Obviously, I come get checked out with you guys, Core Physical Therapy, out on 173rd and Center, whatever the 177th.
76. Yep,
whatever that is, across from Target.
Yep. By Chick-fil-A.
Chick-fil-A.
Come out there, see you guys.
Uh-huh.
Or let's say I just am like, should I go get an MRI? Is there a place I can go that you guys know where I don't have to pay? Because I know there's cheaper imaging places.
Mm-hmm.
Like, what's your guys' tips for everybody?
So
if you want to name drop some places, that would be good. You know what I mean? Obviously, because I think people think I have terrible insurance. I'm not going to go down to Creighton and then they're going to charge me $10,000 to tell me, oh, it's kind of torn.
Right. Well, and I think going
Like, what are the steps
to
save the most money?
Yeah. Going to a trusted healthcare professional, whoever that is. I can think right off the bat of a story where Mark has a friend that actually had a pec injury and saw somebody kind of like in box, we'll just say, right? Like CrossFit athlete saw somebody
A physical
there,
therapist in box who didn't have the experience to diagnose a proper
right,
pec injury.
gave them the wrong advice and
Made it worse.
he became eventually a surgical candidate after 2 or 3 other surgeons were like, we're not touching that.
Yeah, I had to search for a surgeon for this person to do this very delayed surgery. And then, of course, the outcomes on that surgery would never be the same as if you did it, 4 or 5 months later.
Right. So I think it's finding someone who actually that you do trust and that knows what they're talking about in the context of what your expectation is to get back to, right? So that varies from person to person. If it was my mom that maybe had a pec tear, I would be like, okay, we're gonna rest it. My mom's not benching on a regular basis or ever in her entire life. That's different than, a CrossFit athlete, a strength athlete, something like that they have this expectation. So having it checked out, obviously we're biased towards physical therapists, but not necessarily just defaulting to like, oh, okay, I just will automatically rest it for 4 weeks and ignore the bruising. Like I think that's probably one of the telltale signs of any tendon injury is the amount of bruising that's happening. The size of a quarter?
Okay, so here's the story.
Yours didn't actually bruise that much because when they're
Different injury.
Are you talking about the pec tear?
The pec tear, I've seen full thickness and the entire flank, right, totally black. Mm-hmm. You were never in that category.
No, mine was like probably fourth of my pec probably.
And
was where it bled out on that side.
You're also light skinned, so it's going to look worse than it is.
Yeah.
No apparent.
So here's this.
No offense.
Your proximal bicep injury.
So here's the story. So I was incline benching. I felt something tear. So I reached out to my friends here.
Hey.
And at that time, it was like literally like the size of 2 quarters. That's all it had done. And then by the time I go out there and see them, it's like completely bled out.
Well, it starts small.
Yeah. But it wasn't a full tear, which actually my pec took quite a while to bleed out.
Yeah.
It didn't start bleeding out
Just a little
for
deeper.
3-4 days.
Yeah. It's deeper.
But yeah, I mean, so that's a perfect example, right? Of not necessarily just defaulting to, oh, I'm sure it's not that big of a deal. Like getting somebody to look at it right away, whoever that person is. Mark and I being privately owned, like we have the ability to sit there and say, we'll refer you to the absolute best person that we think for that specific injury without the confines of like, oh, you're within, the CHI system or the Ortho Nebraska system or anything like that. So having somebody, I think, to just give you an unbiased look at it, to be like, this is something that you need to do more with, or this is something that you need to do less with. And then it's whatever the decision is, then going through a step-by-step progression of whatever that injury rehab looks like, whether it's stretching, whether it's loading, whether it's, slowly progressive resistance to try to increase blood flow to the area, to rest it fully while you, let some things scar down. Those are all probably specific injury dependent.
Yeah. And sometimes it's just you have to work around it. Say you have an injury and it only hurts when you bench, and it only hurts in certain ranges of motion when you bench. Well, then you bench above and below that, or you load in a way that doesn't irritate that, or you change your grip, or use a multi-grip bar, or you do something that's similar that doesn't irritate it, so you get the blood flow and you get the carryover, but you're not irritating something that's trying to heal.
Yeah, I mean, and if anybody out there, if you get injured, it's not the end. Like
No.
I tore my other
normal.
pec probably 15 years ago in a meet, and this is before I knew you guys. So I was like, I didn't do any PT again. I had bad health insurance, this is how it is. So I was like, but like you were saying, I was like, well, it doesn't hurt when I overhead press.
Mm-hmm.
So I just overhead pressed.
Yeah, that's
I was like,
smart.
hey, my goal is I want to overhead press X, whatever the weight was. And then when it didn't hurt to do any kind of pressing movement, like chest press wise, then I would go back to that.
Mm-hmm.
But now this series, I waited, I think, a week or two, and I started just doing light dumbbells, like 15s. And I would either I would move my arms around in different flared positions where it felt better, worse, whatever. And then each week I just try to go maybe 5 or 10 pounds more, but I'm doing like sets of 20.
Yeah.
Mm-hmm.
And
Or-
obviously if you feel
or
any
blood flow.
pain,
Yeah.
stop.
Yeah, and not all injuries, like you said, are the end of the world. Not all injuries mean, regardless of where it is in your body, not all tendon injuries or ligament injuries or muscle injuries means that like, oh, okay, I'm not doing anything for 3 months.
And you can come back. I came back later. I benched 435 after that. Brandon Jacob has come back. He's still a little leery on his squat, but he's squatted and deadlifted tremendously. You know what I mean? Like,
Yeah, it's a hitch in the road, but it doesn't really stop your progress.
yeah,
Right.
so don't get discouraged. I mean, it
Slows
sucks.
it down for a time. But injuries are just a part of being a good athlete. All athletes get injured, all of them.
Yeah. And that doesn't mean, and just because you tore your pec doesn't mean you can't squat.
No.
Or you can't go and do legs, or you can't, I mean, go do
It's
arms.
funny you
and-
say that. When people get injured, a lot of times they're like, I'm just not going to go to the gym at all. I'm like, why? You can work on everything else. You
Right.
can work on all these things that you didn't have time to work on. But
And even if you tear a bicep, there's the sympathetic response. If you tear your right bicep and you curl
Absolutely.
with your left arm, your
Yes.
right bicep will weirdly get some strength out of
Yes,
that deal.
absolutely.
decrease the atrophy, you'll get better carryover.
You'll have better neuromuscular response.
Yeah.
I have a guy I'm doing programming for in Texas, and he just had shoulder surgery. And I was like, all right, well, I want to take your good shoulder and let's do some laterals. Doesn't have to be heavy. You know what I mean? We still want to do that. Like, and then I'm like, can you curl with your shoulder replaced, with your bad arm? Like, even if it's 5s, do something.
Just do something, yes.
Yeah. But don't go crazy and then be like, I don't know how I got hurt again.
Well, and I think probably too is that for maybe the older generation, there's a little bit of the stigma that like a big injury is like a career ending thing, right? Like the number of athletes that we've seen that have torn an ACL that have gone off to college.
Or
My
professional.
female Achilles that went off and is now a Division I collegiate athlete. Like, yes, I realized at the time it seems like, oh my gosh, I have to have surgery or like something has to be repaired and this is the end and I'm just going to end up, in a wheelchair later on in life. No, I tell people this all the time is if you choose to have surgery and the surgery is the right decision, there's a reason that it's the right decision because you have this expectation of returning to a specific level of function.
Yeah. Very few single injuries are career enders now. If you had 10 surgeries on your knee, you might be in that category. But very rarely does one surgery or one injury ever end your career.
Right.
It just changes it a bit for a time.
I mean, in the powerlifting world, Ed blew his knees out, or blew his knee out. He's had his hips replaced.
Yeah.
Louis broke his back like multiple times. But I think the biggest thing, takeaway from a lot of that is look back at the history of lifters, read what they did to prevent this. There's a reason, like Westside didn't have a ton of injuries, was because of and that's what Ed will always say. He goes, no matter what anybody thinks about Westside, Louis got people to do accessories. And that's where they would do. And he always called them as extra workouts. He'd come back and do 100 reps of pull-aparts, 100 reps of band extensions, tricep extensions. That was all for health.
Yeah.
He makes them like, oh, we'll get our tricep. Well, come on. We all know that you guys needed the blood flow. But go back and see. I mean, it's like anything in history. Go back and see why they were winners.
Yeah. I think it was the thing you had here with Ed and the elite.
Oh, Dave Tate.
Yeah. That one of them, I can't remember who said it, said, some of the most successful lifters that I have had change what their workout plan is 10 times within the course of like when they wake up to when they've completed their workout, because it's based all off of how do I feel? And that's not necessarily saying like, oh, I was supposed to squat, 3 sets of 5. And so I changed my mind. No, it might mean that I'm doing an extra warm-up set today. Or you know what? Like I started my warm-up, something doesn't feel good. I'm going to like bypass and I'm going to go do some calf stretches, or I'm going to go do some eccentric calf lowering, or things like that, that you are listening to your body and taking account of what your body is telling you and not ignoring it. Yes, not necessarily every single workout that you have the ability to say, oh, I have 2 hours of free time to do absolutely everything that I need. But there should be triggers that you pay attention to be like, you know what? Yeah, last time I squatted, like my left calf was super tight and I felt like my left calf or my left heel came up off the ground. Okay, great. That may mean that on your accessory day, you're spending a little bit more time on calf mobility.
Yeah. And weird that could be, but it could also be a shift somewhere else.
Uh-huh.
Just figure yourself out. Have somebody watch you.
Yeah.
Video yourself, you know what I mean? And see where you're struggling with.
Yeah. I mean, it's not great for business, but I would much rather see somebody in clinic for 2 or 3 visits to say, this is what you need to work on. This is what I'm seeing in a squat or a lunge or a running mechanic, and fix it, than have them call up on a Thursday and be like, hey, I had surgery yesterday. Can you fit me in
Over
Friday?
Over lunch.
Over lunch.
Back to what you said earlier, it's kind of interesting. So we were talking about it in the clinic. So you see so many injuries now in the NBA, right? Tons of injuries. So 80s and 90s was much more physical play. You didn't see Achilles tendon tears. You didn't see any of that stuff.
The workouts have changed.
They have. Now, people were much more physical back then. And I don't know that they were bigger or smaller. I don't know. I don't know about all that, because there were some big guys back in the day too, and they played hard.
Mm-hmm.
But the training has absolutely changed, and that's why you get so many more injuries in the NBA than you used to. And of course, in the NFL, you get them too, but there's a variety of reasons for that as well.
Well, and it's similar there. That's like, well, they used to talk about that most of the guys in the NFL, all those hamstring injuries, because they don't train hamstrings.
Mm-hmm.
And that's if you're lifting in a lifter all the time, you're not getting a ton of hamstring work out of your squats.
Mm-hmm. And then, of course, your ankle mobility. So if you go out and sprint.
Yeah, and if you want to be fast, you need hamstrings.
You do. You need glutes, you need hamstrings, you need everything. And you need a mobility.
But I think so many of them have gone just to like, we only do like dynamic lifting during season. And who did I see the other day? It was a collegiate team. God, who was it? And it's one of the top 10 teams. And it was like the week before one of their games, they were all like training fairly heavy. Maybe it was an NFL team. Maybe it was the Eagles or something like that. And they were training heavy. You can train heavy in season.
You can.
Yeah.
Just your volume may change.
Yeah.
It's interesting. If you took a lineman from the mid-90s from Nebraska, right?
The roids era was so good.
Yeah.
Well, if you even take away the drugs, I think they would completely dominate physically anybody in our line now, because they were old school lifting and they were doing it in a way that was the old school way. We've overcomplicated things now.
Yes.
Too much.
But I think and part of that, I think, is every coach is worried about losing their job. If you have a star player get hurt in the weight room, then all of a sudden.
Yeah, you just can't. Yeah, you're not wrong about that. People.
But it used to be if a star player got hurt, they'd be like, well, quit being a pussy. Let's go.
Or they got 3 guys behind them that have been training for years too, ready to step up.
And
they
I
don't have that anymore.
I look at, like, Nebraska was so dominant with Husker Power and you had Boyd Epley. I compare him to, like, when Ronda Rousey first came to the UFC. Like, she was so far ahead of all those girls. She just rolled through. But then when they started catching up, and that's kind of where all the collegiate teams are so even now.
They are.
But in the 90s, Nebraska was so far ahead of everybody. It was probably all that effervescent creatine they had.
Well, you mentioned the drug thing. So Nebraska wasn't the only one using it.
No.
Oklahoma, Miami, we had multiple. It wasn't just, but we were ahead in the strength and conditioning. And you're right, everybody else caught up.
Yeah.
But I don't think that era is that different than now, except our training principles have changed now, and not necessarily a better way. I don't think our athletes really are better than they used to be. Think about all the great athletes in the NFL from the 80s and 90s.
Well, and football is so much more high speed now.
Yeah.
And I think, they're like, oh, we make the equipment safer. That just makes people hit harder.
Yeah.
Like, granted, they get called for, you see those old school videos of the old football hits?
Yeah.
But now they hit so much faster.
Yeah.
But they're like, oh, this helmet, they said I can hit as hard as I want to and I won't be retarded.
Yeah.
So I'm going to hit as hard as I can.
Yeah.
You throw a leather helmet on somebody, that's going to slow down.
Yeah. Oh, yeah.
The contact.
You can bring back the whole rugby argument too. There's less concussions in rugby than there is in football.
Yeah.
Interestingly.
Well, and my concussion thing in football that bothers me is if a defensive player leads with his head, it's targeting. But if a running back leads with his head, it's a great run.
I agree totally.
Yeah.
Sometimes you're tackling in the way you're supposed to, and the running back does it. And how is that your fault?
Yes.
It's not.
Yeah.
You can,
or somebody pulls up all of a sudden, and like you can't stop yourself from moving in midair.
Unless it's like super blatantly, obviously something to try to hurt someone, which is super rare. I think targeting is one of the dumbest calls. It changes the game. It makes it makes it harder to hit people.
Let them play those old school videos where they're hitting those dudes and ripping helmets off. That's great.
Yeah. Well, if you want everybody to be safer, play on grass again. Everybody will be slower.
Well, supposing Nebraska's going to switch back to grass.
It is safer.
But it's even like Dale Earnhardt. Let's take the restrictor plates off and see who the real man is out here.
Yeah, I mean.
So all the prehab, rehab stuff we've kind of talked about. Obviously, a lot of blood flow things. If you think you're determined whether you're hurt or injured, if you really tore something, you'll know if you tore something. You'll hear it inside your body when it happens.
Yeah.
Not everyone else will hear it around you, but
you'll have an inkling.
But get it checked out. Even if, like I said, go out to the guys, obviously Mark and Claire at Core. If you have someone you work with already, make sure. See what it is. And not everything has to be surgical.
No.
Right.
So don't get all weirded out about it.
Most things aren't, actually.
Right.
Yeah, most things don't have to be. Like I said, I tore my one pec 15 probably years ago, and it came back, and it was fine.
Mm-hmm.
But assess all that first. And then now the next thing to talk about is a lot of people, Tanner's talked about it a lot, peptides. I even talked to when I went and I get my blood work done every year. And even my doctor I talked to, he's like, I think peptides are going to be like the wave of the future. And the most common ones you hear are the BPC 157 and what's the other one? TB 500. Yeah. Now, what are your guys' thoughts?
Well, I want to segue into that, but I also want to talk about age real quick. So age is one of those things that those are going to be more important as you age. So say you're 20 years old. Your skin is normal. It's elastic. It's beautiful, right? You're 40. Your skin isn't. Right? It's less elastic.
You're fine, Claire.
Thank you.
I'm not talking about you. I'm just talking about it in general. Your muscles are...
The look of sadness got real heavy over there.
So as you age, your skin changes, right? So
yes.
Your muscles change too. And so the amount of elasticity in your muscles change. The gristliness of your muscles change. The composition of your muscles change. We are programmed to age. So 20 versus 40, you have to think of things differently. Now, peptides change that a little bit on healing, right? So we've seen a lot of research on peptides, a lot. But what we haven't seen is long-term implications of health benefits or maybe more importantly, side effects. Generally speaking, is there a free lunch when you take a medication? Not usually. Early research is good, but because it's not a regulated industry, that's the problem with that industry right now. It's not regulated.
Yeah,
so there's no control of the product. There's no independent research other than the efficacy is actually looking really good right now.
Right.
And these are old. These have been around a long time.
Yeah.
These are 15 plus years old.
Which,
But
if you
we
didn't
don't-
know,
Not
I mean,
new.
the supplement market is not regulated either. If you didn't know that.
No, not at all.
But
Yeah.
we don't have, and that's what I was going to chime in and say, is that we don't have super long-term studies on this. And we do know, and you can kind of extrapolate this, we do know what happens with any sort of supplementation that happens in your body of a naturally occurring substance or something that's a precursor to a naturally occurring
Correct.
substance, that as you externally supplement with it, your internal production of it will decrease because your body's not going to do anything that it doesn't have to.
Yes.
And so I think that's the area of question where, okay, if you're taking something, whether it's in response to an injury or just as a injury prevention, what happens 15, 20, 30 years down the road in terms of these things? Like if we're doing something that people are doing in their 30s, what happens when they're 50? Are we setting these people up for disaster?
And it goes back to testosterone, right? So testosterone is a limiting factor in fibroblast, collagen synthesis, protein synthesis, all this thing. But it has implications in your blood. It has other markers in your blood. And so too much of a good thing can become bad because guess what? Now your blood is thick. Your heart is working too hard to pump the thick blood. It can be an issue. And if there's cycles, that's a different story. But when people are doing it the entire time at an irresponsible way, you're going to have no free lunch. So peptides may be the same way. They're just so new. Testosterone's been around as a supplement for athletes since the 60s, probably in the 40s, 50s. So these are new enough, maybe 15 years, maybe 20, but I started hearing about 15 years ago, that generally speaking, they've been very safe, but not regulated really. And so we don't know quality control and dosing and side effects because they're not studied in that way. But all preliminary research in my small amount of research, anecdotally, they're fantastic, but they look
Looks
good.
good.
Yeah, fibroblastic, collagen, protein synthesis, remodeling tissue, all
You're
better.
talking the peptides, right?
Yeah.
Yeah.
And so when people ask me, do I recommend them? I'm like, off the record, maybe. On the record, I can't, right? Because it's like irresponsible as a medical professional. But off the record, will it help you heal faster, just like testosterone? Yes.
There also was, in the 70s, a medication that we gave pregnant women for morning sickness that we gave them like 5 to 10 years. And then all of a sudden we were like, well, shit, we're making birth defects.
Yeah.
So, I mean, there are some medications that we don't realize what the long-term impact of it is until further on down the road. Now, I will say on
And we
that,
haven't studied peptides, obviously, with women as much.
And the hard
either.
part is it's a double-edged sword. Sorry, I didn't mean to.
Oh, no, you're fine.
But the FDA, the shitty part is peptides are available, not for quotes,
Human
not
consumption.
human consumption. But when the FDA gets involved is when all of a sudden now Big Pharma somehow gets involved, and now the prices are going to double. So that's the shittiest part.
Yep. And I think there's stigmas on certain things, like marijuana falls into this category, that there's probably efficacy that will always be unrealized because there's this stigma that will prevent pure unbiased research.
Well, like nicotine.
Right.
Nicotine has health benefits. It's associated with cigarettes and tobacco, so that's negative, right? But there are health benefits just like caffeine. And so research on nicotine is pretty few and far between from the health point of view because of the stigma, with it, because it's associated with something else.
Now, two of the most commonly researched, just across the board, longest researched substances that technically are drugs, caffeine and creatine.
Yeah.
And
by far the most researched of all sports
And
performance.
then even though it's trendy now, I also am going to, not that it's not as long history as those other two, but colostrum. And I find it very interesting that now all of a sudden these creatine and colostrum, at least from a female health point of view, everybody's talking about it, all the influencers. And
so colostrum is like old school.
Super
Well,
old.
colostrum is like the first milk a cow gives for its babies.
Yes,
Correct.
if you don't realize, colostrum is essentially cow breast milk.
Yeah, but like it's like the first one, like right after it gives birth. It's like the initial.
Yes.
And I learned that on Heartline Vets.
Yeah. So you look at all of the, I guess, the research and the line of thought in healthcare currently where we say, and I'm not a mother, so don't come at me when I say this, but like breast milk is best, right? Like you're talking about helping your baby's immune system and antibodies and things like that you're passing mother to child.
I mean, that's not debatable. It's true.
Right. I'm just saying, well, I don't want to offend anybody.
Doesn't
who
have kids you wouldn't
doesn't
understand.
breastfeed, But that's the same idea, right, behind colostrum. And then all of a sudden it became trendy, and people are like, "Oh, I'm not gonna pay for the $1 million what is that, Armra or whatever that is like the super trendy brand right now." It doesn't have to be expensive. Creatine, same thing. You have all these influencers. There's local influencers that talk about it, like, "Oh, this is amazing. You have to take this, and it's like the single most important thing." Creatine has been around for athletes. Like I'm an elder. We took creatine in college
When you
because
had
they
to
were
load it the first week.
Yeah. Which, interestingly enough, you don't actually have to load 3 grams. Right. 3 grams a day will fully saturate at 3 weeks. This is a study going back over 25 years.
You no longer have to do the 5 to 10 grams a day.
Now, more research is coming out that hyperdosing is actually higher level of efficacy, but that's not at the independent.
Yeah, if you're looking at the athletic level, like some of the more recent stuff, 5 your muscles will saturate. Mm-hmm. If you go 10 grams a day, it starts to give your brain the ability to take that.
Now we're starting to look at other.
And then I don't know. I'm sure you listened to the podcast. Where the lady did the study and they sleep deprive people for like 20 some hours, but then they gave them like 20 grams of creatine, and they tested just as well as the non-sleep deprived.
Yeah. Yes.
So like I have my parents taking like 10 grams a day.
Yeah. Now from our like injury standpoint, a lot of that is full circle. And we go back to blood flow to muscles. Mobility of muscles and tendons, because you're going to shuttle water into muscles and tendons, which helps with mobility and injury prevention. So, we talk about some of these supplements, like some of the peptides that we are seeing these trending positive studies out or positive results. And we're like, okay, yes, there's probably going to be something like 10, 15, 20 years down the road that we're like, dang it, we got it, right? Like we nailed it. There's also some of these things that if you're a little bit less on that, like, I don't know about doing something that's so controversial or, borderline controversial, there are these tried and true tested research things. I mean, you go out there and do just a simple Google search, or if you want to get really fancy, Google Scholar, and then it'll send you to basically the Google research page, and you can type in any supplement.
Yeah.
What's the other?
Go to PubMed, go to examine.com. PubMed or Medline.
You can put in some of these, and I'm telling you, believe me, creatine and caffeine are the number 1 and number 2 researched drugs.
That's very interesting. So colostrum, creatine, caffeine, all naturally occurring substances. Creatine is found in red meat, right? Yes. You eat a ribeye, you're going to get 3 to 5 grams probably.
For a fillet, but...
Okay, well, you'll still get that. Colostrum obviously is a natural substance, and caffeine is an antifungal agent found in the coffee plant at different varied elevations. So it's an antifungal, antioxidant that a plant produces to protect itself from outside activity. So these are all very naturally occurring. Unfortunately, other things are also naturally occurring that are bad for you, like cocaine and opium, but not all things that are natural are good for you. Arsenic is also natural occurring as well, as is strychnine.
So yeah, I mean, if you're dipping your toe in the like injury prevention pond, and you don't want to necessarily go into like some of the NAD supplements and some of the nicotine supplements and things like that, that we're seeing really positive things that we just don't have the longevity studies on. Looking at things like colostrum and creatine and caffeine that are really, really tested is just, I mean, we know it's very safe. And what I always say, the litmus test for these is that they're cheap and they're easily accessible. And the worst thing that probably will happen, with the exception of maybe caffeine, like talk to your healthcare provider, is that the worst thing that'll happen is that you're out the $50 that you spent on that supplement.
Well, and like when I was talking to my doctor that day, we were talking about creatine also, and he's like, even if 5 years down the road, they were like, we were wrong, it didn't show any neurological support, it's going to help you maintain muscle. Especially like with my parents taking it. Like
absolutely.
You're not in the wrong with it.
And we're not seeing, until you get into the level of toxicity, which just means that you've completely not read the instructions and you're just like, more is better, 50, 100 grams a day. We're not seeing any negative side effects. Yeah. So that's why I say like my litmus test, or basically like worst case scenario, is that you get no effect. Yeah. Not worst case scenario is I've made something worse off for myself.
And creatine's produced is a creatine phosphokinase energy system.
CPK.
Yeah, the CPK is one of the first steps in energy transfer to
it is the rate limiting step. No,
correct. So that it's not a foreign substance in your body.
For those Krebs cycle people, CPK is.
Yes. Yeah. You're such a nerd.
Now, do you find it to be, because some stuff will never be accepted, right? Like is never going to be publicly accepted. Like there's a good amount of people that'll tell you, oh, you tore your bicep, take some growth, and it's going to heal faster.
Right.
But that is it hard for someone who came up, you guys are both, lifters, you've been training forever. And in the back of your mind, you're like, man, growth would really heal this fast. But professionally, I'm liable. You know what I mean? If I'm like,
that's why there's an off the record and on the record type of mentality, right?
I would say, and I won't name drop anyone, but we have worked with several ortho physicians that I feel like we have a good enough relationship with that we do talk about some of those things. Not necessarily recommending them, but per se, this person maybe had X, Y, and Z as a supplementation program. You have to take that into account, right? Like you can't put yourself behind the 8 ball when it comes to healing if you've already been in a different place.
Yeah, so if your medical provider doesn't know you're taking super physiological doses of testosterone, they're doing a disservice to everyone.
Right.
Because it's going to change your rehab. It does.
And you need to tell them.
Yeah, exactly.
Be honest. When you go in with them.
And there are times that
you usually can tell.
The patient doesn't want to say it, or the patient won't put it on their past medical history form, and they'll kind of be like, hey, like, just between you and me, like, this is what I'm taking. And HIPAA allows this, is that we do share that information so that all of your healthcare providers can make the appropriate decision. And the 2 ortho surgeons that we refer a lot to, we have a good enough relationship with to be able to say, okay, they are doing X, Y, and Z. Let's not drastically change things. And they both have that conversation with them.
No.
I think it's that that stigma of like, well, I don't want to tell anybody that I'm doing this, that's what gets people in trouble.
Yeah. And I'm not trying to talk anybody out of it. I don't really
Not like,
care.
yeah, I don't care either. Like, I just want to
that's-
know what somebody's doing so that I can make the appropriate decision. If you're taking a super physiological dose of testosterone, you get injured and then you stop, that's going to change my rehab protocol, because now we're in a different position than if you say, okay, I'm going to continue on my dose. My surgeon knows that. My PT knows that. I know that. You know, whoever hopefully is doing some lab testing is knowing that.
Yeah.
That's a different ballgame than somebody being like, well, I didn't tell you that I was going to take or that I was taking this, so I stopped taking it. And maybe that was how the injury happened.
Yeah, that's a really good point. I do see that sometimes when people say that. They'll have an injury, so they like stop everything so they can like heal. I'm like, whoa. If you're taking a super physiological doses of things that aren't naturally occurring in your body, and then you get injured, if you stop all of those cold turkey, you're not going to help your healing rate. You're going to mess your body up in a way that is not beneficial to you.
Right.
So I'm not going to encourage you to continue, but I will
It's like when you go to the
encourage you to
hospital.
continue.
Yeah, it's like when you go to the hospital and you're a smoker. They're going to give you a patch because you're just sending your body into shock by not.
Yes.
But yeah, it goes
Because
back
you're
to
going to go below. Like,
exactly.
if
It
your
goes back to the
testosterone-
same thing, is that when you externally supplement with something, your body just does not instantaneously increase internal production.
It may never.
Yes.
It
Well,
may
and that's
never.
where I think if you're looking for a doctor, like just your general doctor or a PT, and there's multiple things, but what makes you guys great is that you guys have been involved in sports. You've been involved in lifting. You've talked to tons of people. So like, like if someone comes in and they're like, they can talk to you and be like, hey, and you know what they're talking about.
Yeah.
Yeah.
Or you might go to somebody. I've always said like the best trainers are the ones who have all the years under the bar experience. Not saying you shouldn't get like a degree. I'm not saying that, but those are some of the best trainers I've ever met who've been lifting forever. It's just like if I was ever going to get on, I've always been drug free. If I was ever going to get on something, I'm going to ask some of my lifter friends that have been taking roids for 20 years.
Right,
I
you're
could be
not-
like,
yeah.
like, so, hey, when you took this, did this happen? You know what I mean?
Yep.
And that's kind of like with the peptide thing. I know guys who have been taking peptides off and on for injury recovery for 5-10 years. I'm going to ask them, hey, what did you do? Now, ask someone you trust, not just like the largest fucking redhead in the gym,
Right.
but someone who might know what's going on,
Right.
you know, or ask a few people. But also being able to go to PTs like you guys who've been around enough people and seen enough, especially with athletics that know. And also, like, I don't feel like the DEA is going to come to my house. I'm like, hey, so I take this, this, and this,
Right.
You're right.
you know, and it's not like we have to report that,
I quite honestly, I think they have bigger.
which
fish to
is
fry.
also probably a HIPAA thing. You can't report that, I would assume.
Correct. Yeah.
Not
But
without
yeah,
a
but-
subpoena.
But yeah,
But no, and that-
find a doctor that,
that is-
does what you do. You know what I mean? Whether it's your general
Yeah.
practitioner or you're going to a PT, or even if you have a chiropractor that you have a lot of faith in and try, you know, whoever it is, chiropractor, PT, make sure they're on the same page as you.
Right.
Yeah.
And that you
And they know what you're talking about. If I
Yes,
go,
that they know what
if
you're
I go to a
talking
PT and I was like, hey, what do you think of the BPC?
And they're like, what is
And
that?
they're like,
And
what
they
is
look
that?
at you. Yeah. Like, and I said, that's
Which
one
the
of the,
majority of them would be like, what?
yeah. And there's multiple great things you guys do and provide your clinic, but also your guys' knowledge base of being around enough people.
we're nerds.
Because I'm sure even at some point, some people probably come to you and been like, hey, I take this. Like, we have someone who's a good friend of mine that you guys know is a large human. But I'm sure he used to take everything under the sun.
Yeah.
And I'm sure if he said something, you might be like, I don't even know what that is.
Well, I'll have somebody come in and be like, hey, I got this like giant, like swollen area on my, rear end. Can you look at it? I'm like, yeah. Let's look at it for 3 or 4 days. If it seems to get worse or bigger, I'm going to trace it in Sharpie. If it gets worse, I'm going to send you to a guy who's not going to judge you. He's just going to help you, because if you get infected and you get an abscess, you're going to have a problem. Like, I'm fine with that. And a lot of my bigger guys that come in that are, pro bodybuilders or whatever, I'm just like, hey, just make sure you get your blood work. I got a couple of guys I can send you that will do your blood work and talk to you about it, and are not going to give you this shame report about what you're doing to your body, because I will tell them, and they know this, you're not changing what you're doing, and that's fine. Having some knowledge of your blood work when you're doing other things that are super physiologic is actually very beneficial, and some doctors will absolutely just not talk to you.
and I think
And
you should at minimum get it done once a year, if not more. If you're
Yeah.
doing a bunch of stuff,
Yeah,
maybe
every
twice
six-
a year.
Yeah, every 6 months.
Well, and I think this is obviously a slightly a different conversation, but I think men and women who aren't necessarily doing a super physiological dose, but are starting to like dip their toe into some of the like more maintenance doses of things as hormone replacement therapy is getting more and more common for both males and females, then I think going and tying that into like, oh, hey, my body feels like crap. I mean, there is a conversation with injury prevention and injury treatment, injury protocol of saying like, hey, how do you feel about getting somebody else on board that can maybe talk about some of these other things? Like if there's someone that I'm seeing that's a frequent flyer in the clinic, especially if they're female and they're in that, I hate the term perimenopause, they're just in that age group where like there's hormone changes that are happening, that might be part of a conversation of be like, hey, when you go to the OBGYN, are they doing labs? Like, have you ever had blood work done? That maybe you're not just constantly getting injured because you're doing something wrong at the gym. Maybe you're constantly getting injured because your body can't recover. And there are things that you can do that's outside my realm of expertise, but I can certainly push you towards a direction to get you towards somebody who knows exactly what they're talking about.
And to piggyback off of that, so the three tissues we're talking about, tendons, ligaments, and muscles, whether you're low or high on hormones or whatever you're doing, they do not get stronger and weaker at the same rate.
Yes.
And so that's an important takeaway is muscles will get stronger from supplementation faster than the other structures because of the blood flow. And so that's
the highest blood flow.
The highest blood flow will be the strongest indicators of the responders to other things. So it's also important to remember just because your muscles can handle certain loads doesn't mean the things that are down the chain can. You're going to have to take the time. And if you're really high on supplementation, obviously, then that will affect it even more. Yeah, you'll get super strong, but can your body take that? There's certain compounds that a lot of people take that don't have an estrogen component to them. They get injured a lot because they don't.
Dries you out a lot.
And what that means is the estrogen's so low, tissue elasticity goes down. You're stronger, you're bigger, tissue elasticity goes down, injury rates go up.
Yes.
So that's a whole nother, we could do a podcast on that. But tendons and ligaments and muscles do not get stronger or weaker or degrade or recover in the same way. They're totally separate structures that have totally different physiological properties. They're not the same.
Shameless plug, I think, is that if you are in that injury realm, or even if you're interested in injury prevention, things like that, is that, again, like finding a healthcare provider who's not so single-minded, right? Like there are some POPs clinic out there. There's some chain clinics that, whether you're talking about chiropractor or PTs.
People don't know what POPs clinics are.
I have physician-owned physical therapy clinic. POPs. That they're in and out, right? Like, hey, you're here for shoulder pain. I'm going to treat your shoulder pain. I don't care about anything else. Like, out the door. PT is a doctorate program now, and so you're seeing more and more of these people who are, or more and more of these professions that are wanting to look at the person as a whole,
There's
right?
a bigger picture,
and so, yes, shameless plug, but I think that is one thing that Mark and I do really, really well is, like you said, that we've been around athletes and sports our entire life, is that there are things that I could recognize to say, I can help you with A, B, and C. I also recognize that there might be a deficit in X, Y, and Z, and I'm going to send you to somebody who that's their expertise.
Well, yeah, if you walk into, or if you go to a possible clinic, like you've never been to a PT, and you're going to go to a clinic and you walk in and it's just like a bunch of elderly people in there, that might not be the clinic for you.
Yeah, they probably don't know what BB 157 is.
Or they don't know, what a mechanical breakdown in squat position would be.
Yeah.
Right.
So ask some people, like I said, if you're in a gym, ask some people, hey, where do you go? But yeah, get the right place with the right knowledge, but try to do more prehab than rehab.
Yeah.
You can prevent a lot of things. You can't prevent everything. You can prevent forest fires, I once heard, but
Only you.
only you can prevent forest fires.
Yes.
Who was that?
Smokey the
Smokey the
Bear.
Bear. Yeah.
Jeez, you guys.
Yeah.
Oh.
That was like on Saturday morning cartoons. Him and the owl eating the lolly area.
I am
Yeah.
I am
How many
actually the
listeners
elder
take
here.
you to the
I'm
center
the
of
elder
the
here, you guys.
Pop?
Yeah.
I don't remember.
Well, you probably didn't have TV then.
It was black and white. 13-inch black and white.
When you were the remote. Hey, get up there and change the channel.
When there was only 5, so you didn't have.
Yeah, you had to turn the dial. And then what was the other dial? It was like a half channel. The other.
Yeah, I don't know what that
I don't know
was.
what that was.
I think that was to help tune in the
Yeah.
rabbit ears.
Well, it's like the kids don't know, like UHF. When you had an Atari, you had to hook the prongs up on the UHF and the VHF on
you
the
just
TV.
screw them in with a little screwdriver.
I just saw a meme yesterday that was when you can't find the remote and you have to feel up your TV to try to find.
Dude, and some don't have it.
I know.
No.
Yeah,
You're sitting there like, what is my problem? And you're just like,
I woke up in the middle of the night.
No
and
buttons on the front.
I forgot to set the timer like Amber sleep, and I was like, there's an off button on here somewhere.
Well, and the TVs are light, so they start moving, and now they're off kilter, and
You
now
have a
they're.
fingerprint on there, and
Oh man.
Yeah. Well, I appreciate you guys coming out and doing this. It's always good to have you guys
It's
on.
always a pleasure,
Yeah, always a pleasure.
Hopefully people learn some things.
despite us. Hopefully,
Ranting.
What is let's talk about your guys' podcast. Are we making a comeback or what?
we are. Yes, we had to take a little summer hiatus. We were busy, but now,
Straight to the core.
yep, straight to the core on Apple and Spotify.
Yeah,
Yep,
and YouTube.
yep. YouTube's most fun, I think, because you get to see us.
It is.
That's where I watch.
Yeah,
that's where I watch this. I don't listen.
We
to
will be
podcasts.
making a comeback before the end of the year. I don't know when this one's going to come out, but right now it's November. So
Yeah, this
before
will
the
be
end of
out
the
on
year,
Wednesday.
Then. There you go.
So
Yeah.
I don't know how many you had in the queue.
no, we're just week to week. Boom.
Well, most of our podcasts are relevant to what we do, but there are some off topics that seem to actually get better views when we're arguing about something.
Yeah.
Yeah. So check them out. Straight to the core. They have some good episodes out there. Or check them out at Core Omaha.
.com. Yep.
Well, and
Or-
your Instagram is Core Omaha, right?
Yes. Yep. We have a Facebook page too for the elders.
Yes. Facebook is just the worst thing now.
It is
Just a
right now, yeah.
cesspool of lies.
And ads
Yeah.
and marketing
Yeah.
that Claire falls
funnier.
victim to. I'll see some ads on like Instagram or something, and all of a sudden it shows up at the door, and I'm like, "Oh, Claire, you saw the same ones I did."
Oh yeah, I can see what Mark's shopping for because it'll show up on because we're together so much that whatever he's shopping for, then I can tell. I'm like, were you looking at watches?
No,
Yes.
Yes.
no.
We evidently got the same his Christmas present or one of the things that I bought him. I was
A staccato?
Hey. Maybe.
Oh.
Maybe.
Yeah. But I had bought something else.
Did you already get it?
No.
He's touched it.
We're still talking about the staccato.
Guy at the gym had the T-shirt on today.
Yeah.
I don't feel like he probably owns one. I feel like he just owned the T-shirt. Anyway, so I bought something in addition, and Mark was like, "Well, I hope it was this," and I was like, "It was." We obviously had the same ad pop up on social media, so
It gets you every time.
Yeah.
All right, guys. We appreciate you listening. Like, subscribe, share, follow, even if you don't like us. We appreciate your time.
Yeah.
We'll see you guys next time.
Thank
Thank
you.
you.